sometimes the couples have that clarity to go ahead with the right kind of treatment that is suitable for me. Why I say this is that, you want to help one of the couples where they are not very sound financially, and I would like to give them a very simple treatment that is more suitable for them and that doesn't burn their pocket. But they take the right decision based on the explanation, the kind of guidance, the kind of clarity they receive in terms of what treatment is good for them, and they then take that next leap of faith on you and go ahead with a higher treatment and eventually get successful. So, what am I talking about? Which story am I talking about? I'll soon be sharing about this. So, hey, hi, I'm Dr. Indu from Samruddh Fertility and Urology Center, and let me talk about a couple's story where how they wanted to jump to the higher treatment to enhance their chances of pregnancy because of their financial constraint. Now, this is about a couple who is a young couple who is referred to me by one of the doctors. The woman is 23 years old, the husband is 28 years old, and they are actually married for 2.5 years now. When they come to me, they're trying since then, and they have not achieved success yet. They already have started to see the doctor from last 15 months. They have taken many medications, vitamins, and many doctors they have changed, and they have not found any result yet. So they were referred to me with whatever investigations was done, and they have come to me. Now, wife is a housewife, whereas husband is in a decent job with a decent salary. So when they come to me, I go through their records, I take a detailed history, I also do the examination and scan, and check the semen analysis report. So what was found out was that wife was having a very good count of egg on the scan. Her cycles were slightly longer, in the sense it was a little irregular. So she would be ovulating or she may not be ovulating. So she needs the ovarian stimulation treatment at least. For this to be done, her tubes have to be normal. So that also was checked, not in the immediate visit, but yes, in subsequent visit, and that found out to be normal and patent. Husband tests was done, and husband's test showed that the semen count is on the lower side, not very low, but moderately low, and motility is also compromised. So the test was repeated again after about a few weeks, and that report also came out to be compromised, mildly lower count and motility. So this couple were counseled that they can try simpler treatment like IUI treatment, because otherwise natural conception is a challenge because of the low count, because of the low motility that the gentleman had. So they understand this fact. They also understand about this that if they do or give two samples on the day of IUI, two semen samples on the day of IUI, they can pull the semen sample and process it and improve the total motile sperm count, which gets introduced into the, or which is kept into the uterine cavity. So this science they could understand. They understood that such treatment they might need to go through at least 2 to 3 cycles before they think of going ahead with a higher form of treatment. So this clarity they get, and the process starts, and we make them go through one IUI treatment. So the IVF treatment begins, and what IVF treatment is all about is that you have to give stimulating drugs to the wife. So she was a woman with a very good ovarian reserve, so that was the plus point. She was young, but she also had a very good stock of egg. Or ovary showed good number of anti-follicle counts. So she was given stimulation for about 9 to 10 days, and then she showed a good response. She had a lot of follicle developed, and egg pickup was done on the same day. Husband gave the sample, and ICSI was performed. So she had around total around 18 eggs, out of which only 12 were mature, and these 12 eggs were fertilized using husband's sperm with the ICSI method. And at the end, we generally keep embryos for 5 days, and we want the embryos to reach the blastocyst stage. And on day 5, she had grown around 5 to 6 blastocysts. She had beautiful embryos, grade 1 embryos also she around 3 to 4, and another two were of lesser grade quality. Because she had grown so many follicles, her hormones were high, fresh transfer was not done, and we froze all the embryos. So the next cycle, we had to plan a frozen embryo transfer treatment using artificial methods of preparing the bed of the uterus. So this was conducted in the next cycle, where she was given some oral tablets to prepare the bed of the uterus, and embryos were transferred. Now here, When it comes to embryo transfer, what is, because they were young, I encouraged them to take single embryo transfer so that they conceive only with single pregnancy and the chances would be good with the number of embryos that she had formed. But couple thought that no, they want to finish, and they want to have two embryos, and if they conceive with two, then they will finish the family at one go. Somehow, in my practice, I discourage this because twins is something that has its own challenges, and sometimes it may not work in our favor. However, I respected their decision, and I said, okay, we will go ahead with the two embryo transfer, and two embryos were deposited back into the uterine cavity. After 14 days, the result comes as positive and the beta HCG value was really good. So the first scan showed that she has twins. Couple were very happy, and then heartbeat scan was also done, and pregnancy goes smoothly till the third month. That is, NT scan was done. All was fine. The cervical length was all good. I don't put cervical stitch for all women unless it is needed. So, and then she had the anomaly scan at around 18th, 19th week, where all the things were normal. Her cervical length was all good. But in next 2 weeks' time, suddenly she comes with severe pain. And when I examine her, I see that she is already in inevitable abortion kind of a situation. The mouth of the uterus has opened and she is already aborting. So that was really very disappointing, and we had no choice to rescue this pregnancy, and this pregnancy had to be terminated, and that was done for that pregnancy. So this was a huge disappointment, not only for them but also for me or also for our team, because this is not what you want, but sometimes it's everything is not in our control, right? So now, but then what was the ray of hope was that she had few more embryos that were stored in the center. She had few more frozen embryos which she could think of getting transferred, right? So she had to take a break for about 4 to 5 months before she takes the next treatment. So she takes the break of 4 to 5 months and she comes back to me, and this time she's very clear, doctor, I don't want to embryo transfer, I'll go for only one. So much of pain and agony they go through, and they were really very disappointed, considering their financial status and all those things. So this is what also gives us pain when the outcome is not what is desired actually, right? So this time she was very clear, even if it is one, I'll take one embryo at a time and don't want the chance of multiple pregnancy happening. So this time again the protocol was same as I did the last time. I did the transfer with single embryo blastocyst. She was lucky to conceive in this time, and she she conceived. She had a first scan. She had her heartbeat scan, NT scan, anomaly scan. Everything is normal. This time, extra precaution was taken of putting a cervical stitch, even if it was a single, even though it was a singleton pregnancy, but cervical stitch was placed just to ensure or to have that reassurance that this pregnancy will go smooth. Now she's around 8th month of pregnancy. That's where she is right now, and she is going to deliver soon in another 4 to 5 weeks. So this gives so much, immense joy, so much immense happiness when they reach this stage, because when I see them when they came to me at the beginning and they reaching the stage, that is really a very feeling of being grateful towards what they are going to see and the outcome that they are going to experience now very soon. So I'm very happy for them, and I feel that whatever decision they took, though they had the challenge of going through the financial setbacks, they took this decision because this was their priority. Come what may, they had to, or they wanted to have this treatment as the first option, and they have reached here now, and very soon they are going to be parents. So this gives me really immense joy that when the couples take the treatment with clarity and they know what they want to achieve, then it sometimes, definitely it works in favor of them. All that I do, or we as fertility expert do, is just to give them that encouraging an atmosphere or an environment where they have that faith and they have that kind of trust in us to go through this journey as smooth as possible. So, dear viewers, dear friends, if you're watching this, uh, I'm sure you would also be thinking whether single embryo transfer is the best way to go forward when it comes to IVF, or is it double embryo transfer that you should take. This is always a dilemma. This is always a dilemma. Make sure that you discuss this with your doctor thoroughly and understand about your scenario, because if one is going through embryo transfer one by one, there's no fault at all. It's just that you are taking one after the other and you are going to spend another extra month. That's it. And when it comes to expenditure, it is not as much as you would have incurred with the kind of negative outcome if you go through. So if this resonates with you, if you think that there was a lot of information or lot of takeaway from this video, then you can share it with someone who needs it, and you can subscribe to my channel to go through more such stories. So if you have watched this video completely, I am so grateful, thankful. Thank you for watching, and I shall see you soon in my next video. Till then, bye.